Hello and welcome to Truptwellness. This is Dr. Trupti and today we are back again with a very demanding topic, that is diabetes in pregnancy, which is also called as gestational diabetes. Now, many of us know that whenever high glucose levels or sugar levels are found in the blood, it is diagnosed as diabetes. Gestational diabetes is also similar, but here the sugar levels are high only during the 9-month span of pregnancy and usually goes off after the baby is born. In some cases, it may continue even after delivery, which is rare. But again, gestational diabetes is not like type 1 or type 2 diabetes, which continues for lifetime. Also make a note that we are running a series of weight loss related information on our Instagram handle. So do not forget to check it out. Now, why this gestational diabetes happens only during pregnancy? Many of you might wonder that I was not a diabetic before and how can I get it now? So for this, let's understand some physiology first. In normal case, whenever we eat food, the glucose from that food enters the blood. Now the blood sugar level rises. This sends the signal to the pancreas to secrete hormone insulin. The secreted hormone insulin will help to move down the sugar into the cell for energy and also for storage. So the function of hormone insulin is not only to help to utilize the sugar as a energy by cells and muscles, but also to store the excess sugar if it is not needed by the body. Now, once the sugar is used by the cells, the glucose levels come back to normal again. So this is normal physiology. During pregnancy, there is a temporary organ called placenta which is there to help your baby grow. Now this placenta also secretes some hormones like progesterone, placental lactogen, corticotropin releasing hormone, growth hormone in the blood. These are the hormones which impairs the action of insulin, making it less effective. Usually, pancreas adjusts by producing more insulin, but in some cases, the placental hormones are too high that pancreas cannot compensate. And as a result of this, the glucose levels in the blood increases, which we term as gestational diabetes. So now you might have got the reason that why this diabetes goes off after delivery. So once the placenta is expelled out after the childbirth, this diabetes goes off. Now let's see how this gestational diabetes impact mother and the baby. So the first condition is macrosomia. Here the babies of such mothers are bigger or larger, or we can also call as fat babies. Obviously, if the blood glucose level in mother's blood is high constantly, then the same is passed to the baby through placenta. So the baby will receive excess nutrients and the extra energy will be stored in the form of fat, which will make the baby grow bigger or fat. The second impact is if the babies are bigger, then it becomes very difficult for a natural vaginal birth, as the chances of shoulder injuries to the baby is high in such cases. So again, you have to opt either for the induction of labor or C-section. The next impact is increased level of glucose also stimulate baby's pancreas to secrete more insulin. If after delivery the amount of insulin in baby's system is more and if the baby do not get milk from the mother immediately, then the sugar levels will fall off suddenly, causing seizures in the baby, which is also called as hypoglycemic state. So continuous monitoring of such newborns is very essential, and this state can be corrected by prompt feeding, or sometimes intravenous glucose will also be needed. Also, babies with excess insulin will become the children who are at high risk of obesity and the adult who are at high risk of type 2 diabetes. Cardiac defects in the babies can also be found if the sugar is poorly controlled or diagnosed late. The risk of fresh stillbirth is high in such cases where the heartbeats of the baby stops and baby loses the life during the process of labor or delivery. Due to increased level of glucose, baby tends to pass more urine inside the womb, resulting into the increased fluid volume around the baby. This condition is also called as polyhydramnios, where the amniotic fluid levels are more than needed. Now let's see who are at more risk of getting the gestational diabetes than the normal population. The first one is high BMI. Body mass index. So if you fall in the category of overweight or obese, then understand that you are at high risk of getting gestational diabetes and should start screening yourself earlier in the pregnancy. Second one is PCOS, polycystic ovarian syndrome. So if you are already diagnosed case of this condition, then you are again at risk of gestational diabetes. We already know that there is insulin resistance in the pathophysiology of PCOS, so obviously the risk of diabetes increases in such cases. Next is one who has strong family history of diabetes mellitus, whether it might be from your maternal or paternal side. Next is one who had gestational diabetes in her previous pregnancy, means she was suffering from diabetes in her first pregnancy and the diabetes has gone off, but again she has high risk to suffer from the same in current pregnancy too. Next is one who have given birth to bigger babies in previous delivery, like more than 4 kg weight, or one who had stillbirth in previous pregnancy. And the last one is multiple pregnancy. If the mother is carrying more than one baby, then she is at more risk of diabetes than other mothers, and the increasing age also contributes this list. If you are above 30, then you should screen yourself for gestational diabetes from the first trimester itself. So this was all about understanding gestational diabetes. In next episode, we will see the screening and diagnostic test, when it should be done and what are the detailed procedures and how the results are interpreted. Till then, stay happy, stay blessed. Thank you.